The first 2 weeks of your knee replacement recovery. Here are the key things we're going to talk about. Number one, your pain medication schedule. Your surgeon gave you a schedule of when to take your pain medicine. Yes, you need to take them. It's so important because we want you to stay ahead of the pain. That nerve block you were given in the surgery center was great to block the pain, but that is going to wear off and suddenly you are going to feel a lot of pain. And sometimes people are, oh, I don't like pain medication. If you know there's certain medications that don't agree with you, talk to your surgeon right away, hopefully ahead of time. If you've started taking it and you know it's not agreeing with you, please let your surgeon know so they can get you something that's going to work better for you. Number two, sleep. This was really a hard one for me. I found it really challenging. Some people have no problems at all. I'm not sure what camp you're going to fall into, but most importantly, you want to make sure, if you can, to try and sleep on your back if possible. Some people really enjoy sleeping in recliners the first few weeks, but again, it may not be good if you have a history of back pain. So please be careful about that. If you wake up during the night and you find that your leg is really stiff, gently bend your knee 10 to 12 times to try to reduce a little bit of that stiffness. Sometimes even taking extra pain medication at night can help as well. A big thing here, a little potty talk. It is really important that you are having regular bowel movements because a common side effect of anesthesia and pain medicine can sometimes be constipation. If you have not had a normal bowel movement on your normal schedule after you get home from the hospital, it's really important that you reach out to your healthcare provider and let them know that, because if you've been drinking all the fluids, maybe taking more fiber, nothing's working, you need to let them know. Why, you wonder? Well, if we're straining at some point because you're constipated to have a bowel movement, you could actually tear open those internal stitches in your knee, as crazy as that sounds. And even more important is if you're constipated, the pain medication isn't working. And that could be a big part of why you may be having what we call breakthrough pain. So some of you might be wondering, hey, I want to take a shower. No problem, but let's be really careful. Make sure you have somebody nearby, especially the first time you're going to try this. And if your bandage is not waterproof, you need to make sure you protect it. Really important. I highly recommend that you have a shower chair and your walker, if you can fit it into the shower, to make sure you are safe. If you have a handheld shower attachment, that's going to help as well. And hey, if you drop something, leave it. Let somebody else pick it up. Most importantly, take your time, be mindful. We don't want you to risk a fall. So sometime during the first 2 weeks, you are either going to go and have out for physical therapy, or you may have somebody come to your home. I think it's great, but I got to tell you, I cannot emphasize this enough. It is your job to do your exercises every single day as instructed. And really, your first exercise goal, the first 2 weeks, and the most important, is something called extension. Extension is when we have the goal to straighten that new bionic knee and leg completely out straight. You're going to be measured on this regularly. It's really important that you focus on extension, or what I always said, straightening my leg. You're also going to hear the word flexion. This is the degree of bend in your knee. A lot of people tend to worry about this way too early in recovery. Pro tip here, the faster you get to a straight leg, the faster you're going to be able to bend that knee. And then finally, let's talk about the RICE method: resting, icing, compression, and elevating. Icing and elevating are really key for your pain control. You've got to take it really seriously. Rest as much as possible those first 2 weeks. Your body is recovering from major surgery that power tools were probably used. Ice your knee. At a minimum, you should ice for 20 minutes every 3 hours while elevating your leg. Doesn't matter if it's an ice pack or a fancy ice machine, you need to do this. It's so important. If you were given compression stockings at the hospital to wear, continue to wear them as directed. And again, as I was just saying, elevate your leg to help you reduce swelling and straighten it, because straightening your whole leg is important. And again, do not put a pillow under that new knee to bend your knee. Instead, get a pile of pillows that your whole leg can be supported on. Okay. Those are my big takeaways for people on their first 2 weeks. Next, we're going to move on over to weeks 2 and 4. But remember, if you do nothing else, please take your pain medication on the schedule your doctor was given. Alrighty, here we are, entering weeks 2 through 4. Friendly reminder, everybody's journey is different. You might be ahead of schedule, or maybe you're not ready for this yet. Either way, it's fine. Here are some key things I talk to people that I coach during weeks 2 through 4. If you're having trouble sleeping, we talk a lot about methods to make that better. And everybody starts to have a little, I like to call, mental health challenge sometime in this time period. It's super common to start feeling really emotional. You could feel frustrated, regretful for doing this, sad, angry. You might even shed a tear or two, mainly due to fatigue, cabin fever. Maybe you're not managing your pain well. All of this leads to frustration that can really start to weigh on your mental health. Deep breath, my friend. Make sure you are talking to some positive people. If you need a coach, I'm here to help you out. Get some fresh air, sit outside, and take in a different view. And yes, please talk, not text, but talk to some positive people. What I did early on is I started a little journal of my daily wins and what was something I could do today that I couldn't do 2 weeks ago. It really did remind me how far I'm coming. And I always remind somebody at this point, you're a few weeks into a 1 year full recovery, but don't worry. In a few months, you're going to forget you even did this. Sometime during this time period, you're going to have a little visit with your surgeon. This is a great time to bring questions that you might have for your surgeon, that if you're having trouble with sleeping, managing your pain, swelling, make sure you write all this down so you have it ready to ask, because sometimes we just forget when we get in front of the doctor. And make sure you write down your answers too. At this point, you're thinking, hey, what about this scar? What can I start doing with it? Nothing quite yet, not till that bandage comes off. And don't worry, I'm going to talk about that when we get to months 1 through 3. This is about the time for me, once that bandage came off and the stitches are coming out, I am like, oh my goodness, I am having this terrible feeling of pins and needles. A lot of people will call them zinger sensation. Just start icing more. That will help. And start to desensitize your knee. What do I mean by that? Start putting light fabric or touching your knee a little more frequently. And over time, you're going to start breaking down that sensitivity. You might also notice that your knee feels numb. Totally normal. Don't panic. Physical therapy is going to be a daily thing in your life. You got to make sure you are doing your exercises every single day that you can. I was a huge fan of using a recumbent bike. I talk a lot about it in our book, Knee Replacement Secrets. If you have access to a recumbent bike, foot pedaler, that's really going to help you get your range of motion. A couple key things here. One, if you suddenly have an emergency need for dental work, make sure you talk to your surgeon and your dentist before you go. Most of them have rules on what type of antibiotics they want you to take before you do it. And if you are getting ready to go out in the world, please, even if you're walking around the house at this point without your walker, make sure you bring it for those first few times you're going out, because you need to give yourself plenty of time. You've already practiced getting in and out of the car at this point, and I do have helpful hints on my website at thekneezone.com about a protocol to get in and out of the car. But if you are going out somewhere, which isn't unusual at this point, make sure if it's over 2 hours that you bring an ice pack and you ice. And if it's over 2 hours, you got to get out of that car and walk around a little bit, or you are going to be unbelievably stiff. And that walker, why do you need your walker? Because you might encounter a real low chair or, God forbid, a real low toilet, and you're going to want that walker to help you get up and down. So just keep that in mind. Next, we're going to jump on over. And look at you. You might even get close to jumping in month 1 or 3, at least one little hop. So let's move on over there. All righty, here we are. We're going to talk about months 1 through 3. I'm going to remind you, progress is not linear. Recovery is going to involve some ups and downs. Sometimes you're going to feel like you took a step backwards before making significant progress forward. I'll remind you again, celebrate your small wins. Maybe you've improved your range of motion. You're walking around with no problem. These are all things to celebrate. You should continue to manage your pain, swelling, and stiffness. Now, at this point, through months 1 and 3, you're going to start seeing it become easier and easier. This is when I always point out to people that I'm coaching, let's stop using the word pain and start using the word stiffness. Really ask yourself, am I truly in pain or am I just stiff? Because this starts to help your mind realize you're healing. This is a weird time too, when your weather changes, especially if it gets colder, that metal in your knee is probably going to alert you weather changes are coming. Totally normal. And long drives, again, anything over 2 hours could start to cause some swelling and stiffness. So make sure you take breaks often if you're going for long drives. This is a great time to start looking at returning to some physical activities that you've been missing out on. I will caution you, begin slowly to increase activities. You're not going to go play a pickleball tournament, play 18 holes of golf, walking, run around with your grandkids, picking them up off the floor. Slow and steady. Begin slowly to increase your activity. One day you're going to do all those things, but again, slow and steady wins the race. Maybe take on some easy projects around the house. Yes, time to maybe start thinking about returning to adult activities. This is a great time to start practicing kneeling. We have a whole protocol in our book about each step you can do to get back to kneeling if that's something important to you. Now, again, for some of you, you may be going back to work, you may be volunteering, you may be helping out with taking care of folks. Mental exhaustion and stress really can get to you in these early days, months 1 through 3. Make sure that you are getting enough rest. You don't overdo it because it can really take a toll. Some of you are going to be like, hey, I'm planning a cruise. I'm going on vacation. I'm all for it. If you're feeling up for it, go for it. Obviously, talk to your surgeon and your physical therapist. But I've had many people that I've coached go on cruises and trips in months 2 and 3. But be smart about it. I have a whole travel checklist. If you need some help with that, just drop me an email. I'm happy to share that in detail with you. But around this time, you're going to keep adjusting to your new knees. And it's really important that you understand that by month 3, most people should reach 90, 95 degrees of bending. Yes, totally normal to be stiff, and that could persist for many, many months. However, if you have not reached 90 degrees at this point, you're going to have a conversation about having what's called a manipulation under anesthesia. I'm not going to get into that today, but I want you to know that you've got a goal. 90 degrees by 3 months. Focused all the time on your physical therapy, building up your quad strength. Like it says on our little form here, keep doing your PT. You're not done yet. We are entering months 4 through 12. This is really when I go back to reminding you, everybody's on a different recovery journey. I'm going to give you just the broad strokes of what you can expect somewhere between months 4 and 12 because we're all different. But the best news of all, you're going to be doing things pain-free. Are you still going to feel stiff from time to time? 100%. But every month when we celebrate our kneeversary, make sure you do that every month. Celebrate your kneeversary. You're going to realize you're making progress. So it's important in month 4 and 5, make sure you're not losing range of motion. Yep, can actually happen. You got to keep doing your PT. Make sure you're massaging that scar to break up the scar tissue. If you are worried about how it looks, I was putting ointment on mine 2 or 3 times a day. Now, when people look at my legs, you can barely see that I even had a scar. This is a really good time if you are using an exercise bike to start lowering the height of the exercise bike or bringing it in if you're using a recumbent bike. We keep pushing on your range of motion because we want to continue to get as many gains on your range of motion as you can. If you haven't tried pool therapy yet, this is a great time, depending on the weather where you are. Many cities have public use shallow pools just for this purpose. I did it myself. I loved it. If you get a chance to try it, I would really encourage you. If you haven't started kneeling on a pillow yet, now's the time, my friend. If you are really into Pilates, yoga, things of that sort, you will want to have some sort of padded kneel cushion, probably going forward for quite some time. But at some point, you can kneel on the floor without it. So, something to look forward to. Again, as it says on our cute little diagram here, yep, you are going to feel stiff, maybe a little swelling, soreness, tightness. This is all part of it. That happens when you've done too much and you're at that phase in your recovery. It's all going to be experimental. You're trying to figure out what's too much, what's not enough. I encourage you to push yourself, but if you have a day you're like, oh, wow, that was a lot, that means you did too much. Pull it back a little bit. Try again in another week or two. If you're noticing your knee feels hot, totally normal. It will go away over time, just like those zingers are going to go away that you're having. Now, in months 4 and 12, I really you're encouraging you. Make sure you challenge yourself and get good at going up and down stairs. You probably hated stairs before your knee replacement. It's time to start doing them. It's going to eventually feel easy and pain-free. You'll marvel at how easily you can go up and down stairs. The best way to do that is to start practicing, as well as practice balancing, doing squats, doing lunges. Anything else you want to try at this point is normally fair game. That could be any of the sports you've been wanting to do, anything. Trip-wise, it's time to get out there and do these things. As you approach your 1-year anniversary, please just take a moment to reflect back and think about how far you've come in your journey. Celebrate your progress. It's really important. And just remind yourself, like I said, everybody's journey is different. Most people I coach, the number one thing I see is they are not strengthening their quads enough. They start to slack off on doing their exercises. If you think that's you, you got to remind yourself your recovery is up to you. You can have the best surgeon in the world. Lucky for me, I'm married to one of them. That didn't make me not have to do my physical therapy. I had to do it every day. As you continue to get stronger and stronger, you can just say yes to all the things you said no to in the past. Yes to a hike, yes to a vacation, yes to going up and down stairs, all the things. It's time to shift your mindset because you have done the hard things. You are ready to do it. Somewhere between months 6 and 12, everything is going to click into place and you're going to have days you've completely forgotten you had a knee replacement. So bravo. Thanks for sticking with me. I hope you found this helpful. And if you did, I do have detailed recovery guides that we talk about this, and you have a chance to purchase those from us, as well as our book, Knee Replacement Secrets, that's available on Amazon.